Let's start by looking at the definition of holism. Holism is caring for the whole person and addressing their physical, emotional, social, and spiritual needs. It is rooted in the understanding that all of these aspects affect overall health, and being unwell in one of these areas can affect patients in other areas. To do this well, it takes all of us to be students of our practice and to look at every patient as our patients. Before these patients ever get to the postoperative stage, they often have seen many of you in this room trying to get resolved for their issues, such as physical therapy, family practice, chiropractors, pain management specialists, just to name a few. Once in the hospital, there is a whole other set of care providers that take care of these patients, both in the OR and on the floor. Imagine the things we can do if all of us were looking at the patient and what they needed holistically throughout the weeks, months, and sometimes years before they get to the postoperative stage and throughout the postoperative stage. Today I'm going to share a story with you that has led me to my passion of providing care in a holistic way. There were many times during my daughter Jada's health journey that changed the direction of her recovery due to the care providers taking this approach. Jada was always such a happy, healthy, vibrant little girl who had a love for dance from the time she could walk. This was Jada on her 12th birthday. The only thing she wanted for her birthday was a pair of Heeley shoes, and against my better judgment, that's what she got. She immediately threw them on, and down the driveway she went. She immediately fell and hit her coccyx. When I got to her, I immediately knew something was wrong. Her pupils were dilated, and she was complaining more of a headache than a backache. X-ray showed no breaks. Her pupils were normal by the time we got her to the hospital, so we were told that she was good to go and just needed time to heal. She continued with pain and headaches in the following days. We had multiple visits to the ED over the next several months, just to be told nothing was wrong. She then began having speech problems and difficulty walking. They ordered another lumbar scan, which looked normal. The radiologist knew something had to be going on and talked with the ED doctor about scanning up higher. The thoracic scan showed a large searing, so they decided to do one more scan in the cervical area, and that's when she was diagnosed with Chiari. It, of course, was not the answer we were hoping for, but we were nevertheless grateful to have an answer so that we could start towards her recovery. The decision was made to do surgery, and she was sent to Primary Children's Hospital. Dr. Brockmeyer was just finishing up his day when he saw the way that she was presenting and decided to throw his team back together to do surgery that night. She had a tough couple days post-op. She did not eat, developed anxiety, and her pain was constant. On the third day, Jada's CNA mentioned to the nurse that she thought a therapy dog would help. Sure enough, they brought in Molly the therapy dog, and this completely changed Jada's mood and mindset. These visits made such a difference. She was smiling, started eating again, and was able to be discharged on the 4th day in the hospital. Jada did well for about 2 weeks after she got home, then started complaining again about headaches, back spasms, and her anxiety peaked again. We took her to the doctor several times, and they would just start her on more medications, which didn't seem to have much of an effect. All tests showed she was fine, but she wasn't fine. She would cry and cry at home, and we tried everything from acupuncture to massage to energy work, and nothing would help. We finally took her to a rehab doctor at Primary Children's, hoping that more intense physical therapy would help. Dr. Green assessed her and thought that what she was experiencing was more psychological than physical. He wanted to start her on the antidepressant amitriptyline, which I of course rolled my eyes at the thought of more medication, but at this point I was desperate to try anything. After about a week and a half, we saw improvement. She was eating more and wanting to hang out with her friends again. I was so grateful there were clinicians out there who looked at her in a holistic way. I will never forget that radiologist, rehab doctor, and surgeon for helping her get her life back. This is Jada a little over a year later when she was back to dancing, and this is Jada now. She is 100% recovered and just made me a grandma, so life could not be better for her or for me. Being a grandparent is the best, any of you that know. There are so many stories like Jada's out there. As we focus on collaboration with each other, we also need to keep our minds open to addressing the whole patient. With as busy as we all get, I know this can be a challenge, but each of us have our own experiences, both through life and through our work, that can help guide the right decisions for our patients. Taking this holistic approach, as we focus on the key principles of postoperative care, will ultimately lead us to the outcomes and patient experience we strive to achieve. Several studies over the past 5 years have shown that education, which meets the expectation of the patient, is empowering to them, which leads to improvement of outcomes, better self-management, and an earlier discharge. What are the patients expecting? Research has shown that early education, providing a consistent message, and ensuring the patient understands is key. Movement is something to focus on both pre and post-surgery. A study from October of 2023 looked at 500 patients who underwent general surgery, orthopedic, and neurosurgeries. They found through using an activity tracking device that patients who took fewer steps preoperatively had a higher rate of complications post-surgery. The odds of complications after 90 days were reduced by half if the patient took more than 7,500 steps a day before the operation. Post-surgery, we know that movement helps ease pain and inflammation, prevents DVTs, and helps the patient build confidence and an overall sense of well-being. Getting our patients up early after surgery is important. Even though they may still be a little woozy, like Mr. Zarinsky in this picture, the care team can work together to get the patient up safely. This is something the patient should be educated on before they ever get to the hospital. Our goal is to get the patients up within 12 hours post-op, and we're working towards moving that standard to 6 hours. With the rise in addiction and mortality surrounding opioid misuse, there has been an increased demand for developing pain treatment strategies using a multimodal approach. Our approach to this in the hospital starts with setting a realistic pain goal. Our first-line medications are non-narcotics and muscle relaxers, and then using narcotics as a last resort. Early in the process, we empower the patients with the things they can do themselves to address pain without or in addition to their pain medications. Got to give a shout out to one of our former RNs, Steve Schiss, who's here with us today, for creating this acronym, BRINE. It's widely used throughout our hospital to make it simple for the patients and caregivers to remember these important tactics for pain control. Nutritional status is a strong predictor of postoperative outcomes and can be the thing that's most often overlooked in the hospital setting. Diets that consist of protein-rich foods, whole grains, fruits, vegetables, dairy products, in addition to staying hydrated, are important for surgical healing, overall performance, and weight control. Focusing on nutrition preoperatively is just as important as it is postoperatively. This is a simple visual to use as a guide for our patients' nutrition before surgery. To make it simple for them, an effective approach to postoperative nutrition is preoperative nutrition in reverse. Generally, it's recommended to resume oral feeding as soon as possible after surgery, with the goal of returning to solid foods within 24 hours. Our ultimate goal through all of this is to provide the patient with their desired outcomes and positive patient experience. At Utah Valley Hospital, we are succeeding at this. This is a snapshot of our neurosurgery patients who have taken our patient experience survey since the beginning of the year, and so far we are performing in the 90th percentile. Successful surgery for the patient means not only recovering, but regaining physical, mental, and spiritual health as a whole. Treating the patient holistically is best achieved by a coordinated approach embedded in a culture of learning, collaboration, and safety as we work towards getting them back to life. I will always be deeply grateful for the care providers who took this approach while caring for my daughter. I would like to conclude with a patient letter we received that reminded me of how we all contribute to their experience, no matter what your role is. I just wanted you to know that I appreciate the staff that took care of me. You all were great. Housekeeping kept my room clean and neat. Each one of them was truly sweet. Room service brought my food on a tray, polite and helpful in every way. Physical therapy walked with me, had no choice, I was getting up and going, you see. The lab people were awesome too. Drawing blood is not so easy to do. Case managers, social workers, and such didn't realize you all helped so much. The surgeon gave me peace of mind at a time I was in a bind. Of course, I saved the best for last, my awesome nurses and techs on staff. When I pushed the button, you answered my call in little time at all. Through all of this, you cared and listened to me during my time of need. I'd like to thank each one of you now, so step on forward and take a bow. Thank you, everyone.